First Nations TV supports working together towards closing the gap in health, education, economic development outcomes and opportunities for Aboriginal and Torres Strait Islander people.
If we can't look after our First people, in this country, then really, what are we doing? And if a society is measured by the wellness and the healthiness of their children, again, what are we doing?
I'm a part of the Close the Gap campaign and support it because I believe in equality. I believe essentially in that great Australian saying, a fair go for all.
I wanted to do a bit more than the average person because it's something I felt so strongly about.
With the support of people like you, Indigenous health is starting to improve. But it's only together that we'll get the ongoing commitment and funding from government that will achieve Aboriginal and Torres Strait Islander health equality by 2030.
This COAG funding has improved health outcomes within our community. Under the Healthy Transition to Adulthood program, we elected to bring on 5 young trainees and train them to become Aboriginal health workers. 2 of them be trained as mental health first aid instructors. Around chronic disease, Aboriginal people are now taking control of their health. We have empowered them. We have given them the access to good information and we've given them access to good, strong, culturally appropriate health care. The other area that we're really seeing some excellent results is around child and maternal health, where we're getting leading specialists at King Edward Memorial Hospital for Women complementing our service on how well we do so.
In the 5 years that I've been working here, the babies' weights have increased and the babies that are being born are much more robust and healthier looking children.
At SWAMS we've done all we can to try and be as innovative as possible. The iHealth camera enables images to be taken and we then send those remotely back to the Lions Eye Institute in Perth, and an ophthalmologist there can engage in a Skype consultation with our patients. It's fantastic technology and it's helping to close the gap in this area.
Been through a bit with my mum and that's ended up making me feel quite depressed, so ever since I've been coming here it's turned my life around. I was a really shy person, but now I'm the type of person that'll get out there in the community. It's pushed me to get a job. I've been employed. They see me as a really big role model in our family and our community.
If the funding stops, the groups will stop. They'll go back into their old lifestyle. It's hard to build up trust with people, and once you take that funding away and say, oh look, we can't have the groups no more, then the trust stops.
The first 4 years was only the building blocks. We now need to be able to continue on so that we can put the house together. At the moment, we've just got the foundation down, and that's what the first 4 years was about, was putting down good, solid foundations in health services. It's the next 4 years of funding that will become the critical part of COAG, and whether or not we will make a difference.
It's really about sustainability. It's really about these programs being ongoing and well supported.
Investing in a healthy future means empowering the community to take control and direction of their own health.
Coming to this healing group has helped me invest in my health.
It's not an Aboriginal problem or an Aboriginal issue. It's a national issue. It's a national solution that we need. Everybody needs to work in together.
To all the supporters out there, we will make a difference. We will get there, and thank you.
Working together we can close the gap.
can chill in the job, yeah, I can live in my, I can chill in the job.